So one of the biggest yet most ignored causes of heart problems is potassium deficiencies. Potassium regulates heart rate, blood pressure, and circulation. Doctors in the 1950s found that natural potassium from food could stabilize an irregular heartbeat within minutes. But instead of recommending potassium-rich foods like bananas, avocados, and leafy greens, modern medicine relied on beta blockers and diuretics, which ironically deplete the body even further. Welcome back to the Freedom Health Show, and I am Dr. Matt Gianforte, and today we are going to uncover a hidden cause of heart disease that most doctors ignore, and this is nutrient deficiencies. Hey, it's February, and it's Heart Month, right? Mainstream medicine focuses on cholesterol, salt, and medications, but what if I told you that the missing nutrient from your diet could be a real culprit behind these heart problems? Nutrient deficiencies caused by processed foods, sugars, and stripped-down diets can lead to irregular heartbeats, weak heart muscles, high blood pressure, and even heart failure. Instead of fixing the root cause, modern medicine has just jumped straight into medication and only masking the symptoms. Today, we're going to break down how malnutrition damages the heart, which nutrients are essential, and why fixing your diet might be the best way to protect yourself. Your heart is a muscle. And like any muscle, it needs the right nutrition to function properly. Without them, the heart can develop irregular rhythms, blockages, and weak contractions. So take irregular heartbeat, for example. The heart electrical signals rely on B vitamins, especially B4. So when missing, you can experience skip beats, extra beats, or even dangerous arrhythmias. Another issue is enlarged heart. Research from the 1950s show that patients given B vitamins saw their hearts shrink back to normal size within minutes. But instead of addressing the nutrition, the doctors prescribe drugs that only manage the symptoms. So why don't we treat the heart disease with real food and key nutrients? Well, because the medical system is built around prescriptions and not prevention. You're listening to the Freedom Health Show today with Dr. Matt Gianforte. If you want real natural solutions to your health, visit LifeWorksKC.com. Now, let's dive into how these vitamins actually control heart function. Okay? Your heart has two jobs. One, to pump blood, and two, adjust to your body's needs. But it can't do this without the right nutrients. Vitamin C, this essential vitamin, which we use all the time in our practice, okay? From supplementation to high-dose vitamin C in our IVs. It strengthens blood vessels. It helps prevent high blood pressure and circulation issues. Low levels can cause chest pain and fatigue. Now, another vitamin, vitamin E, regulates calcium movement in the heart. This deficiency can lead to irregular heartbeats and even heart failure. Vitamin G relaxes blood vessels and improves circulation. Low levels are linked to cold hands, tight chest, and hypertension. And then there's vitamin E2. This works well, and it's a natural nitroglycerin for the body. So what it does is it opens up the arteries and repairs damaged tissue. So if these vitamins are so critical, why aren't cardiologists testing for them? Because there's no money in nutrition, but there's plenty of lifelong prescriptions. You're tuned into the Freedom Health Show. If this is changing how you think about heart health, then follow us on Apple Podcasts and Spotify. Now, let's talk about the powerful roles of potassium and why this matters more than just a pill, okay? So one of the biggest yet most ignored causes of heart problems is potassium deficiencies. Potassium regulates heart rate, blood pressure, and circulation. Doctors in the 1950s found that natural potassium from food could stabilize an irregular heartbeat within minutes. But instead of recommending potassium-rich foods like bananas, avocados, and leafy greens, modern medicine relied on beta blockers and diuretics, which ironically deplete the body even further of potassium. Many people suffering from racing hearts, high blood pressure, and irregular heartbeats could see huge improvements by just fixing their diet alone. You know, the big takeaway here is heart disease isn't just about cholesterol and not eating salt in your diet. It's about the missing nutrients. You know, most modern heart problems today stem from deficiencies that doctors never test for. You know, instead of spending your life managing symptoms, Let's start focusing on giving your body what it needs to heal. If this episode opened your eyes, then hey guys, subscribe to the show, The Freedom Health Show, on Apple Podcasts, Spotify. Visit us at LifeWorksKC.com. And if you want more help specifically for your body, give us a call. Go to our website, request an appointment, a consultation. Let's start rebuilding your body from the inside. So until next time, stay empowered and stay healthy.